Fadi, could you explain All-On-4 treatment?
It's basically for terminal dentition. So if you've got no teeth, or if you have a set of teeth that are beyond dental treatment, extensive gum disease, extremely decayed teeth, and you need to have those teeth cleared, but you need to have an implant system placed and be able to have a fully functioning mouth. So the All-On-4, All-On-X system allows you to do that immediately, which is amazing.
So how does it work?
It works, again, like everything else, with very meticulous planning. We need to have a very accurate CBCT scan to look at the bone density, bone levels. We need to have all the records that we normally have for digital smile design so that we can look at the existing dentition, study where the teeth are. In this particular treatment, what's beautiful about it is you have a blank canvas and you can put the teeth in the ideal position. So we can plan for the ideal, because the teeth are coming out, or if there isn't any, we have the ability to construct them, put the teeth in the ideal position that suits the face, and that's important. And from there, work backwards on where the implants go and where our planning all matches up.
So you get the implants and then you have to wait?
No. So the beautiful thing about this, it's an immediate implant solution. It's an immediate fix solution. So literally you'll be getting your teeth within a few days, your final teeth. But you often get your teeth on the day, an initial printed set. So you'll have the teeth out, all the infection cleared out, all the gum and bone curetted and cleaned out, and then the implants placed. And with digital technology, we already have our design at hand, and we marry up the implant position, and within a few hours, we're able to print an initial set of teeth in-house and place directly into the patient's mouth, just to verify everything that we've done prior.
What kind of impact does a treatment like that normally have on a patient?
Look, without a doubt, this is the greatest impact for any patient that I've seen out of any of the procedures we do. The changes in personality, the changes in lives, when you help someone with this procedure and you've had that first interview and consultation with them where they're often crying or scared, and then you see what they look like when they first look at their teeth in the mirror, it's undoubtedly the most rewarding thing that I experience in dentistry. And every case has the same beautiful feel about it, because every case is special, because it's special for that patient and it's special for us.
What do patients tell you about this treatment?
What they tell me is they regret not having it done any sooner. That is a common theme, because firstly, most patients don't do it for several reasons, but often they're scared, thinking that it's going to be exceptionally painful. And a lot of them don't even realise that it is doable in the way that we do it, or the way that it's done. But once they do it, they often say, I wish I did this 10 years ago.
Why do you approach it your way?
I guess everybody says they do something differently within a certain treatment. It's like I do my veneers differently. But let's apply the same principles that I apply to my aesthetic work to my All-On-4, All-On-X treatments. Firstly, I spend a lot of time assessing the cases. I look at the age of the patient. I look at longevity. I look at what's the etiology that they lost their teeth. And it's not just a cookie cutter approach. It's very bespoke. There's many ways that we can provide this. We can add artificial gum. There's techniques where now we're not even adding the artificial gum, where in certain age groups we're finding placing the implants and keeping their own gum. So that's a whole new discipline that we're starting to really get some amazing results. But again, each case is specifically designed. We look at each case, we plan, we look at the ideal implant position, we look at the ideal aesthetic position. I feel that we do it well, and that's, I think, our point of difference. I've seen a lot of other cases, there's a lot of great surgeons out there, but I think the ability to marry up the aesthetic, the surgical, the most suitable for that patient's age and demographic. And what's important is we're seeing these cases now from early 30s to late 70s. You can't be doing the same treatment, and you've got to be understanding the longevity factor. If you're treating a 35, 40-year-old that still has another 50 years to live, you really can't be giving end-stage treatments, or at least not having that consideration. There are so many ways now to be able to restore. And one of the things we learned from this is, being a Zaga clinic and working with world-renowned surgeons and seeing in these atrophic cases what are the options. people speak about zygomatic implants, but there's even other techniques. There's new implant positions that allow us, that we never knew we could place implants, certain special areas anatomically that allow you to add extra support for the implant bridges. And again, this is just through knowledge and liaising with world-renowned surgeons that allow us to better and provide these techniques. And that's a big game changer for patients that think they can't be helped. The most beautiful part about this procedure is you can really touch someone, give them the ability to be able to smile again, to be able to be confident in public, not put their hands over their mouth, not feel conscious or be judged. I mean, that is a superpower.